The research we have undertaken at the University of Birmingham, particularly with regards to service delivery, started with looking at how we could safely transfer the management of patients receiving oral anticoagulation from secondary care outpatient clinics into primary care. This was driven essentially by the huge increase in numbers of patients receiving oral anticoagulation. We initially started with a very small pilot study which looked at treating patients in the community using near-patient testing to do the blood test that is required, known as the INR, for patients receiving oral anticoagulation. We then moved on to a larger study based in 12 general practices around the West Midlands, using near-patient testing for the INR test, but also incorporating expert computerized decision support software to provide instant dosing for the patients once the blood test had been undertaken. This study demonstrated improved therapeutic control in terms of INR control and some suggestion that there was a reduction in adverse events, particularly stroke. The impact of this has been to effectively transfer care from secondary care into primary care, both safely and effectively, and the model of care that we developed is now widely known as the Birmingham model of oral anticoagulation. The further impact of the research undertaken at the University of Birmingham in terms of transfer of care from secondary care to primary care for patients receiving oral anticoagulation was its introduction into the National General Practice contract as a national enhanced service, which remains current to this day. And there has been a shift of perhaps 30 to 40% of patients out of the traditional secondary care model into patients being managed with the Birmingham model of primary care management. This has also been adopted internationally and is now recognised as a safe and effective method of service delivery for patients receiving oral anticoagulation.